Thank you. And how to follow that. So thanks to Sir Selden for grounding all of us, and particularly me, before speaking to you today. When Charlotte asked me to speak to you today, I thought hard about what I could add to this list of fascinating speakers. And whilst I don't work in schools, I'd like to instill in you a sense that the health and education fields are like close siblings. They're so intertwined. So a bit about me so you'll know where I'm coming from. I'm a public health doctor, and most of you, like most of my medical friends, won't have a clue what this means. So I think the official definition of public health is the science and art of preventing disease, prolonging life, and promoting health through the organised efforts and informed choices of societies, organisations, individuals, and communities. So as you can see from this definition, schools as an organisation, as part of the society and part of the community, and a place where children and young people spend vast amounts of their time, is very much part of the public health fraternity and has a crucial role to play in the public's health. I chose a career in public health, in part due to the frustration of seeing condition after condition in the hospital, which I felt could have been prevented. Throughout medical school and the narrow medical lens in which we approached illness and disease, I'd always had an interest in sociology and anthropology and an understanding of how wider social factors influences or impacts on people's health and well-being. And when I first started out in public health, I wanted to focus my attention on more marginalised groups, including people with severe mental health problems and homeless people. But it became increasingly apparent that the root causes of many people's difficulties lay in the early years. And this is where I wanted to focus my attentions on. So now I have a special interest in children's public health. And I hope to spend my professional years in this area. So back to the talk, I'd like to first describe to you a few key public health principles which will help us understand how teaching yoga in schools can really make a difference. Secondly, I'd like to set the context by providing a few key facts around child and adolescent health and well-being in the UK today. And thirdly, I'd like to describe the role of schools and the evidence base around promoting health and well-being in schools and colleges. And finally, I'd like to end by discussing how teaching yoga fits into this agenda of promoting health and well-being in schools. So, some key public health concepts. So, concept number one, that prevention is better than cure. So all of you know this, and this is a no-brainer for moral reasons, obviously to prevent a lot of suffering, but also for economic reasons. Cure simply costs much more. I was just discussing with a colleague just before I spoke about the costs of things like child obesity, mental health problems, costing society billions of pounds. However, for centuries, and even to this day, cure predominates in medicine, and indeed our whole health service is structured around the idea of cure. And this needs to change. And whilst there is a lot of rhetoric about prevention, it still hasn't really been matched by funding, and even only in last week's budget, the prevention bit of the NHS has been cut, whilst the rest of the NHS was relatively protected. And this might be due to the fact that preventative interventions take time to exert their impact, and certainly beyond the 5-year political cycles that certain people care about, prevention may not play as a prominent place in policy. So the second key point is that there are social determinants of health and well-being. So this is a oft-quoted public health diagram by some people called Dahlgren and Whitehead. And it may or may not come as a surprise to you that medical care is not the main driver of people's health. It's obviously crucial, important, but only a small role in people's health and well-being. So the fact whether or not we're healthy depends on individual things that we can't modify, like our genes and our gender, but also individual lifestyle factors, whether we smoke, drink, do yoga, for instance. On top of all that is the huge importance of our family, our parents, our communities, education, whether we have a job, housing, whether we have a house, or how, things like damp in the house. All these things have an impact on physical and mental health. And surrounding all of this, the blue layer talks about the general social, economic, and cultural circumstances in which we are born, grow, live, age, work, and things like taxation, welfare policies have an impact on health and well-being, and also industry influences can impact, on things like the content of our food. So this is quite a neat diagram for kind of conceptualizing the wider determinants of health. Point number 3, around health inequalities, that there is, in England today, people in different social circumstances experience avoidable differences in health, well-being, length of life, and this is quite simply unfair. As you can see from this diagram, people from lower socioeconomic groups, which are on the right, have higher death rates for all sorts of reasons. And we know that inequalities in health arise because of inequalities in society. And since health is influenced by the conditions in which we are born, grow, live, work and age, as you saw from the previous slide, that action to tackle health inequalities means we must also tackle these social determinants of health. The fourth key principle is around health in the life course is influenced by an accumulation of positive and negative impacts on health over a lifetime. As such, early years, including the school age years, are a crucial time to intervene, to promote those positive assets and to minimize those negative risks that will cause, that may impact on health later on in life, and also can have an impact, by intervening in early years, can have an impact in reducing health inequalities also. So to come back to this idea about child health in the UK, so there's been a shift in the burden of disease in the last century from largely due to successes in medicine and public health. So infectious diseases have been largely replaced by long-term chronic diseases, things like cancer, heart disease, diabetes, which may be in part due to an aging population and increases in life expectancy, but also due to changes in society that have caused things like increased sedentary lifestyles and changes in diet. So we need a different approach to tackle these long-term lifestyle-related conditions, and a preventative approach, taking into consideration the social determinants of health and tackling health inequalities, is essential to this. In terms of child health over the past century, there's been great improvements, especially in the health of the under fives. So fortunately, things like infections, infant and maternal mortality are much less common these days, in part due to things like housing, sanitation, antibiotics, immunisation, but also things in medical care, obstetric care, neonatal care. So the under fives have done well, but unfortunately there has been less improvements in adolescence. This is the only age group that hasn't seen an improvement in their health status in the last 3 decades. This may be in part due to the false view that adolescence is a healthy period of life. We know that actually adolescents utilise health services more than any child age group other than the under threes. But also it might be due to societal views of adolescence, which are on the whole, as you probably agree, quite negative. So as a result, we need to focus our attention now on adolescence. It's a crucial time for promoting health due to rapid brain changes and susceptibility to peer influences. Adolescents often engage in exploratory, risk-taking behaviour, and things like engaging in smoking, drinking, drugs, unsafe sex. All these sort of risk-taking behaviours may be in a healthy, normal part of adolescence, but obviously damaging in excess and can have real impacts on health and educational outcomes. We know that social and emotional factors often underpin many of these risk-taking behaviours. And we know that these behaviours, things like smoking, drinking, eating habits, are also risk factors for poor health in later life. But thankfully, the rates of many of these behaviours, risk-taking behaviours, have seen profound declines in the last decade. So the rates of smoking, drinking, taking drugs, engaging in violence, they've all been seen a decline. And as this graph shows, the teenage pregnancy rate has also seen considerable improvements in the last 10 years. However, what has been more worrying in recent years is mental health problems and self-harm. We know from national surveys that well-being declines in the school age years, and that most lifetime mental health problems have their origins in childhood and adolescence. There's a figure of 3/4 of adult mental health problems commence before 18 years of age. We know that poor mental health impacts on life chances and that the increases risks of offending, taking drugs, teenage pregnancy. The UK ranks poorly amongst OECD countries for children's well-being. The last national prevalence survey of child and adolescent mental health in the UK found that around 1 in 10 children had a diagnosable mental health problem. And although we haven't had more data on this, a new survey is due in the next couple of years. Anecdotally, and including reports from teachers and people like yourselves, people have been saying, and there is some emerging evidence to suggest that mental health problems and self-harm particularly have been on the rise. And there may be many potential causes for this. The financial climate and austerity, and the impact this has on families and communities, exam stress, uncertain job market for young people, and also the rise in digital media and with the resulting pressures on things like cyberbullying and unattainable ideals of perfection, all must be taking its toll on young people, and this on a background of a society that's increasingly individualised and commercialised. But on also cuts and funding pressures in child and adolescent mental health services may mean that the thresholds to refer to mental health services are very high, and as a result, families and teachers are containing and holding a lot more vulnerability and a lot more vulnerable young people. And obesity as well, we need to mention, is another major public health problem that doesn't seem to be improving. The rates of obesity, although maybe levelling off, there are marked socioeconomic differences, and particularly young people from more deprived communities have much higher rates. It's thought that about 1/3 of young people between the ages of 11 and 15 are overweight, and about 1 in 6 are obese. Okay, so moving on to what we can do about some of these health issues, so promoting health and well-being in schools and colleges. So schools and colleges have a crucial role to play in this agenda. They have an important role in the social and emotional development at a time when young people are establishing their identity, they're testing and exploring boundaries, And at a time where relationships and interpersonal peer influences are so crucial, schools have a role in creating resilience so that young people have the inner resources to cope and have to buffer any negative influences and to flourish. And this is particularly true for those children who come from disadvantaged backgrounds whereby schools may be the only form of support. Schools have a crucial role also in promoting healthy lifestyles. As we mentioned, obesity, a big challenge, so promoting physical activity and healthy eating. And taking those public health key concepts, we can see how schools have a role in prevention. The promotion of health and well-being and resilience is important to prevent future health problems later on in life. So what does the evidence suggest that we should do? So firstly, if we take classroom-based approaches, PSHE, we know that classroom-based teaching and other names for it, so social emotional learning, emotional literacy, emotional intelligence, coping skills, life skills, all of these can be effective in improving health and educational outcomes. Well-designed and well-implemented, I think these are the key things, programs can reduce the prevalence of mental health problems such as depression and anxiety, reduce the risk factors for mental health, including traits such as impulsivity, as well as promoting competencies for good mental health, such as empathy, self-esteem, and optimism. These programs have also been shown to reduce the risk-taking behaviour, those behaviours that we just described. Effective programs tend to focus on the positive, with teaching focusing on building young people's social and emotional skills rather than focusing on the deficit-based and problem behaviours and focusing on risks. These programs also need to be interactive and person-centred. I think education and information, alone is ineffective. It needs to address attitudes, values, beliefs and feelings. These interventions also have an impact on educational outcomes, and I'll give you an example from one study. A recent US meta-analysis summarised research for over 200 social and emotional interventions and suggested that schools with effective programs showed an 11% increase in achievement tests, 25% improvement in social and emotional skills, and 10% decrease in classroom misbehaviour, anxiety and depression. So these approaches really can work, and let's hope PSHE becomes statutory, as it was suggested in the last year's Select Committee report. But we should also mention the importance of taking a whole school approach. So there is strong evidence that a whole school approach to promoting health and well-being improves outcomes. And this is the approach advocated by the health body NICE, that's the National Institute of Health and Care Excellence, but also other agencies like Public Health England and even the Department for Education. During the 1990s, the World Health Organization developed something called the Health Promoting Schools Initiative. This takes a multi-component approach, including, firstly, formal curriculum teaching for students to develop the knowledge, skills, and attitudes to make healthy choices. This is a bit like the classroom-based teaching we've just described. But on top of this, and crucially, it goes on to a crucial component is to change the ethos, values, and attitudes in the school, as well as the physical environment, to one that promotes health and well-being. The rationale behind it is that children learn about health in the classroom, what children learn about health in the classroom must be promoted in the wider school environment, and that promoting these values are likely to have more of an impact. So it's about promoting values and attitudes, but also more tangible things, In the physical environment, for example, providing cycle racks to promote active transport, cycling to school, or providing healthy food choices in the canteen. And thirdly, this whole school approach also takes, or the health promoting school approach also creates links with families and the wider communities. And as we've seen from previous slides, children have a life outside of school, and it's important that those links are created to promote health. And a recent Cochrane review, and a Cochrane review is one of these big meta-studies of lots of randomized controlled trials, found, and so this actually analysed 67 randomized controlled trials from over 1,000 schools, and found that this approach had a tangible, significant effect on reducing the body mass index, marker of obesity, increased physical activity and fitness levels, improved fruit and vegetable consumption, decreased cigarette use, and reduced reports of being bullied. And this approach is effective, as you can see, since it works on the multiple layers of influence of health at the individual and at the school and at the family community level. It should also be noted that on top of all these universal approaches working to help all children and young people in the school or college, targeted approaches may also need to be taken for students at risk of or already exhibiting signs of difficulties, and targeted approaches also have an impact. I also just want to share with you a couple of useful frameworks that might be useful to consider for schools. The first was from Public Health England, published this year. Again, it's using this idea of a whole school approach. I'll just kind of talk you through it in case you can't see the text. So at the top, it talks about curriculum teaching and learning to promote resilience, as we mentioned, enabling students to have a voice to influence decisions, staff development. I think this is key, as Sir Selden was saying about the importance of staff finding their own silence. So this is important, but also teaching staff about how to teach things like PSHE in the curriculum. Identifying need and monitoring impact. And there is talk around sort of measuring well-being in schools. This is an emerging area. Working with parents, targeted support, as we mentioned, and an ethos and environment that promotes respect, values, and diversity. Another useful framework around academic resilience, and this is from Prof. Angie Hart's work. This is, again, I'm not going to go through this in detail, but you can look this up. It shows around different things to promote resilience in schools. And so finally, just want to spend the last few moments to consider how promoting yoga in schools can work in this agenda. Any of us who practice yoga know how deeply transformative it is. As a moving meditation, it teaches us to engage with that parasympathetic or the restful nervous system and away from the sympathetic or fight or flight nervous system, which is in itself a key life skill for engaging or dealing with life's ups and downs. This is important for all children and young people, but particularly for those young people who might have had traumatic childhoods and as a result are spending more of their time in that sympathetic or fight or flight nervous system. And using the resilience framework that I put up, you can see how yoga may be helpful, especially around the domains around coping and core self. And whilst there's emerging evidence on the effectiveness of mindfulness in schools, in terms of reducing mental health problems and promoting well-being, there may be additional benefits of yoga, a sort of moving meditation practice in promoting physical activity and other health benefits as a result. And the research around yoga is emerging, may need to be strengthened in order to generate the evidence. I think later speakers will go into more detail about the emerging evidence base, so I won't. But as we mentioned, taking a whole school approach perhaps may be effective. So yoga should be one component of a whole school approach to the promoting of health, reinforcing those health messages taught in the curriculum and in line with the ethos and values of the school. Ideally, it should be part of a whole community approach, but this may be wishful thinking. But in itself, providing children and young people the experience of being in a state of peace, balance, and even joy is a truly glorious thing. And I think that's why most of us, or all of us, are here today. Thank you very much. Yeah. Questions? Or?
Yeah, we're running a little bit late, but we've got time for one or two questions if anyone has them. I don't know if... Yeah.
You mentioned resilience in schools quite a lot. Can you just expand a little bit for me, please?
Yeah, so the sort of definition is sort of doing well, flourishing despite adversity. So particularly for those young people who've had a tough time, or from disadvantaged families having really sort of poor experiences, how can you make them flourish or achieve in terms of educational outcomes or health outcomes despite that adversity?
Schools. Sorry, do I need to repeat, or did you hear?
No, I heard that.
Okay, there are obviously programmes around to support schools from Young Minds and places like that with to support resilience and so on. But I was interested in to what extent there are case studies available from schools that either have effective PSHE or whole school programmes available, or even kind of programmes and suggestions about how schools get started, because I think there's no lack of a desire to support the students with mental health issues, but it's more how do people get started. Particularly, I think there are issues in not, obviously there's difficulties in not doing it effectively. You wouldn't want to harm someone's mental health if you intervened inappropriately.
Yeah, so you mentioned sort of Young Minds, so that I think the Young Minds use that resilience framework in their consultancy work to schools. I think they encourage all schools to sort of use this kind of framework to work themselves around it, but I think there are organisations like them who would help schools on the journey. I'm not aware of particular case studies about how whole school approaches have been used, but I think Young Minds would be a good place to start, I think.